All right, hi everyone. Today we have a breast augmentation. So there's a couple points in this video that I want to highlight. One of them is basically pocket position, and the other one is implant shape. Okay, so you can see this patient is very, very thin, right? So I believe that the side of her breast, the silhouette on the side of the breast, it's already where we want it. And how do you know how far out you want your breast implant to go? I mean, there is some ways that you can go a little bit further. You can really minimize it, but the kind of general rule of thumb is that if you have the patient's side of the chest, and then you want the silhouette of the breast, the side, to sort of just kiss it, just touch it, So if you're looking at it from the front, it just sort of come out just a little bit beyond it, just kind of like kiss that little side right there. And here you can see it's already doing that. You don't want it out too far, because then when she moves her arm, when someone's active, I mean, they're gonna be like rubbing it and kind of like always bumping to the breast, and really not a lot of people would favor that. I mean, some people want a lot of side because they think it looks a little bit more sexy or whatever, but I think in general most people want it to just come out just enough to kiss sort of like the side of the chest. Okay, so with her, you want to use an implant with the smallest diameter possible that gives her projection. So that implant is the ultra high implant. The ultra high implant has given two sizes. It has the smallest diameter and the fullest projection. That's what you want for someone like her, because if you go with a high profile or moderate plus or whatever, it's not going to work, because that implant is too wide and it's going to come out to the side. And also, if the implant's too wide, it's not going to fit in the pocket. It's going to kind of bend a little bit, and so it's not going to look great. And so we're going with the ultra high implant. The other point is pocket position. 90% of how breast augmentation, how the result turned out, has to do with pocket position. So with her, I marked down her breast fold right here. Okay, you can see this breast fold is higher. So if I were to just leave her breast the way it is and just make a little incision and put in the implant, this implant would sit higher. So when she wears her clothes, you would notice one higher than the other. And so that's not very cute. Okay, so we have to change her breast fold. Now we got to be very careful when we say that, because technically you're not supposed to like change someone's breast fold, because you can get a double bubble. But if the breast fold is very constricted, means very deep, then you can't do that, because if you do, you are going to get a double bubble. Not to get the double bubble, I'll get into that in another video, but because her breast fold is not very constricted, I'm going to lower it to the same height. Okay, so I'm going to lower about 1 centimeter, so that way her cleavage would land in the same places. Okay, so so that's the key to the surgery. And so we're going to go with, she already, I mean, as thin as she is, she has a good amount of breast tissue actually. I mean, but we're thinking about 340, 375, and she's leaning toward 375. So I think that's going to look just fine on her. I mean, she likes the fullness. She likes the fullness a lot in the middle, and that's what we're going to try for her. All right, we are done. So again, pocket placement. So as you can see, these two lines represent her breast fold. Okay, so she had uneven breast fold before, and like I said, you have to make them the same. So one was lower, one was higher. Now they're both completely even. Hence, her cleavage is completely even. And this is the size she wanted. We were thinking 375 or 340. 375 looked a little tight, so I went with 340 cc implant. They're placed underneath the muscle. And these, again, are the ultra-high implant. And you can see, I mean, it's coming out to the side pretty well already. Any other side where a size, shape would have just come out too far. So I think this is a great size and shape for her. And this is what she wanted. I mean, for some, it may be a little bit too big. For some, it may not be big enough, but it's all a matter of preference, and this is what she likes, because I saw the photos that she liked, and so that's how I kind of picked this size for her.